Welcome to those of you who are just joining. We're going to go ahead and get started to be respectful of everyone's time. Again, my name is Sophie Phillips. I'm the CEO of TexProtects and Prevent Child Abuse Texas. And we have such a great dynamic conversation today with three incredible leaders in Texas. And so to set the stage, Tuesday, TexProtects held a webinar about what the existing child protection system looks like here in Texas. And today I'm excited to have Ann Hilligenstein, Senior Director of Casey Family Programs, Deneen Dryden, the new Associate Commissioner of CPS for Texas. Welcome, Deneen. And our Associate Commissioner of the Prevention and Early Intervention Division of Department of Family and Protective Services, Sasha Roscoe, with us today as we talk about a real prevention and family preservation vision for our child protection system. And so Ann Hilligenstein will kick us off, and she's really going to tell us what the data says about the way our system works right now and the outcomes for kids. Then we're going to go into a presentation by Sasha to talk about what our prevention strategies look like to date and some of the new innovations that Texas has really been able to lead the country in. And then we'll hear from our new CPS Commissioner, Deneen, and talk about what that family preservation model really looks like. And I know her, along with the new Commissioner of the Department of Family and Protective Services, Jamie Masters, are just really excited to put this new vision out there about prevention and how we can best protect families. And this is something that Ann Hilligenstein says all the time, but most kids and families don't need protecting, they just need help. And so, you know, today I think we want to think about how we can flip the existing child protection system, you know, on its head and envision a world where we create this great environment that is fostering connections and supports for families and making sure that we do have a safety net in place, and those kids that really are in difficult positions and not safe, that we have an environment that really works for them, but when possible, how can we keep families together and preserve that? Because ultimately we know that most kids do better, of course, when they're with their parents and they're with their families. And with that, I'm going to turn it over to Ann Hilligenstein, Senior Director of Casey Family Programs. Also, for those of you who, you know, I don't know how anybody doesn't know Ann, but previous commissioner over DFPS several years ago, and just so grateful to have Ann and Casey Family Programs as great partners in our work to prevent child abuse and neglect. So Ann, off to you.
Great. Thank you, Sophie. I appreciate that, the nice introduction, and I want to welcome everybody who's joining us today. I'm going to quickly go through some information here, just starting out. Clearly by the slides, you all are experts. I can see that. And hold on, we've got a little bit of backing up here I have to do on the slide. So Beth, oh, there we go. Okay, great. So let me jump ahead here. Well, there's that. So back up here, we go. So what do we know from the research? And more importantly, what do we know from families and what they tell us? I'm not going to go through this. You all know this. You are experts. And we know that foster care is often not the best solution. In fact, we know that children who grow up in foster care often have very poor outcomes in terms of education, mental health, substance abuse, homelessness, employment, and almost 10% of former foster youth who have babies, those babies come into care. That tells us a lot about where most states are investing the heaviest. And we really need to think that. So I want to give you a bit of a backdrop, almost a scene setter for where does Texas stand today. And this is just going to be a very quick lead in to the really detailed information that Deneen and Sasha are going to share with you. I do have to say, Texas has invested in prevention, and it really looks like it has paid off. Working for Casey, I'm fortunate in that I have a panoramic view of the country, and Texas has much to be proud of, but there's a lot further to go. So I just want to give you, again, as the scene setter, just a couple of comparative slides. If we look at Texas and the nation, Texas screens in at a lower rate. These are calls made to the hotline and are filtered out because they are not issues of protection. And Texas does a better job doing that, quite frankly, than nationwide, and taking less intrusive approaches with families. Do we have enough? No, definitely not. But we have the tools to do that if we choose to invest in the right direction. We validate reports that are investigated. We validate at the national rate, but the entry rate of children coming into foster care is far less. Again, I think, has prevention paid off? Yes, both in terms of in-home services to families and, very importantly, community services that families can be directed to. That's actually pretty remarkable that the number of children coming into care hasn't soared. Just if you look at the demographics of Texas and the surge in the child population, while our population the last few years, child population has grown by 6%, the number of children coming into care remains quite low. That's at only a 1% increase. So I think the question I think a lot of people are going to ask, so if Texas is taking a less intrusive approach vis-a-vis its investment in prevention, and it is removing fewer children, taking them from their own families far less often than the nation, so many other states, does that mean Texas children are less safe? And the answer is no. When we look at the recurrence of maltreatment in Texas within 6 months, it's half that nationally. When we look at recurrence of maltreatment within 12 months, it's also much lower, 6% in Texas versus 10% coming back to the system in, if you look at national data. If we look at permanency for Texas children who have come into care is consistent with the nation, but our re-entry rate is half the nation. So I think what we're seeing is some really good investments have paid off for children and families in Texas. And what we're going to look at is what that picture looks like today, but why we have to continue to move forward and not settle for where we are today. I just want to provide this. This is kind of follow-up for those of you who joined us for the earlier meeting this week with the Policy Roundtable. Joyce James did a terrific job presenting on disproportionality in child welfare, particularly in foster care. And I'm just going to leave this slide here just for information. We're not going to go through it. It's pretty complex, but Texas, like every other state in the nation, has a disproportionality problem, particularly when we look at Black and African American families and children. And breaking up families for that cohort is clearly an issue that I know we all want to address. So with that, I'm going to hand it over to Sasha.
Sasha, we can't hear you.
Darn, I was really hoping to make it through a day without talking while muted. So, sorry about that. So good afternoon. I just hope to give you a quick glimpse of the work of the prevention arm of the agency that Anne sort of referenced, and we're so pleased that it does seem to be having an impact on the downstream work, because that was certainly the intent of our state appropriators and federal funders as well. You'll probably hear me say something like this a couple of times, but we use a public health framework for looking at child abuse and neglect. So much like our public health colleagues look at the risk of heart disease or diabetes as being a collection of both risk factors to sort of address and protective factors to enhance, we take a similar view at child abuse and neglect, and that means this division does a lot of matching of data to look at what are risk factors that are correlated, at least, if not necessarily causing abuse or neglect. And within that framework, hold on, I don't seem to be able to advance these slides, Beth, or maybe is there a delay perhaps? We talk about child abuse and neglect in this context. So using, and I'm on the first slide, but I don't seem to be able to get there myself, but I'm going to keep going. If you use heart disease as an example, we talk about prevention as having primary preventative activities that are really actions you take to address risk for everyone in the population level. So with heart disease, that would be advice about nutrition and exercise and perhaps screenings at your annual visits that screen for other risk factors like high cholesterol. In child abuse and neglect, that is really happening outside of the agency's work for the most part. That's what churches and communities and parks and family members provide families, and it's that kind of interaction with kids and families every day, and the variety of things that help families thrive that is in that space. With some, we fund a little bit of work that does go at the population level, but where the prevention efforts of this agency are really focused are in secondary prevention. And that's when you start seeing risk factors. Using heart disease again, that would be things like high cholesterol or perhaps being overweight, and you start in more structured evidence-based efforts to attack those risk factors. In child abuse and neglect prevention, that looks like evidence-based programming, counseling for families, kind of addressing substance abuse, treatment, or mental health needs that are causing the relationship between parent and child to be unhealthy. And then lastly, you have tertiary prevention, which is efforts that come after you've already had an event that you're trying to avoid, like a heart attack, and you might have surgery, and then you might go back to some of those very treatments that are that you might have used to prevent the heart attack in the first place, like exercise. And then, okay, I can now move. Now you can see my pictures. Then in child protection, that is obviously what our colleagues in CPS do when they intervene. There has already been child abuse or neglect, and they then are working with the family to stabilize them and hopefully return the child and make that family a protective place for that child going forward and prevent any re-entry into the child protective system. So that's kind of how we think about the prevention work and where PEI fits in relative to our colleagues in child protective investigations and child protective services. Another kind of framework for the work of PEI is that it's two generational. So we know the best way to help children are to help parents. So we fund a variety of services that both help children, like youth mentorship or positive youth development activities in the community that give them these protective factors of resilience. And then we also, our primary work is funding work with parents, like our home visiting programs. We also have parent support groups, fatherhood groups. We also do individual parent education through sort of a crisis counseling modality when parents hit those bumps in the road. So that's the kind of body of work and how we think about it, both helping kids and parents, and hopefully together in unison. Sorry again about the delay. I seem to hit a lot of buttons, but not much happens. The prevention division, just as at a glance, includes about $107 million in federal and state dollars that fund a little over 300 community-based organizations. We do not have any staff in the prevention division doing any of this work. We are a granting organization that just grant funds this work at the community level. So your school districts, your nonprofits, maybe your local mental health authorities, a variety of different community organizations are offering all of these services to families that are all coming to that service through a variety of front doors in the community. They might be referred by a school counselor, a pediatrician, a family member, a pastor. So it's really resources that go to these community organizations, and we serve a little over 67,000 youth and families through those services. Part of the prevention kind of framework means a lot of data and analysis that we are in fact doing what we set out to do. And Anne gave a lot of examples of seeing that downstream, but we also measure each of the families that we serve, we match their data against our Child Protective Services colleagues' data 1 year, 2 year, and 3 years out, and even 3 years later, post-services, 94% of our families have not encountered the child welfare system or have a confirmed case of abuse or neglect. So that is our biggest outcome measure, but we also do the same thing with our youth that we serve, and we match that with our partners at the Texas Juvenile Justice Department. And so 99% of our youth serve are also not referred to juvenile probation, because our legislature is also funding us to protect kids and stabilize them so they don't encounter that other intensive sort of downstream system. And we also do a pre and post survey and measure that we're increasing protective factors that we know to be associated with lower rates of abuse or neglect. So we're very focused on outcomes. And then in addition to funding services, which is our primary function, we do also support that work through obviously training and professional development, a lot of data analysis. And we look at fatalities in particular as sort of our worst outcome to inform our prevention efforts, but we have an analytic unit studying child abuse and fatality data. And lastly, we know that these services alone aren't all families need, and we work with our colleagues across other systems, and we encourage and support that kind of backbone work at the community level for child and family service providers to be connected to not just other child and family service organizations like the schools or pediatricians, but even other community budgeting arms like their city or county commissioners, and trying to provide the kind of data about how kids are doing and inform budget priorities at the local level. So we also fund that type of look at how the health of children through those mechanisms. Just a couple examples of the types of innovation that these efforts have produced. The first is to just talk about these risk maps, which are available to everyone. That we worked with the University of Texas using, and I know now everybody knows what an epidemiologist is, but using an epidemiological framework to match a lot of data that seems associated with high rates of abuse or neglect, and to map it so that communities could see both hotspots at the zip code level for where maltreatment seems to be higher based on a high presence of these correlated risk factors, and also to inform the kind of outreach efforts that our community-based organizations are always struggling to sort of find a way to voluntarily engage families earlier into these services that we know to be less intrusive, lower cost, and more protective. And so you can see on the map the kinds of factors that we pulled in the data include things like employment, things that I think most of us would guess. Employment levels, the levels of enrollment in SNAP or WIC, hospitalization data, crime data. Some of the key factors that pop up over and over again as fairly indicative of risk levels at a community. Some of these do kind of show as individual risk factors, but mostly we're just talking about community level risk factors. If you see high rates of smoking during pregnancy, high rates of fathers not being on birth certificates, high rates of assaults needing medical attention, and high rates of adults living on SSI or Social Security, which is both, a proxy for not being able to work. Those are all kind of correlated, and it also gives you an idea of where we might be able to intersect with families that have high risk. For example, we've partnered with WIC to work on smoking cessation programs. So it's given us we kind of talk about this as sort of the beginning of precision medicine and attacking abuse and neglect, but getting really smart about how and where to help families, not just in our services, but in other services that they are encountering. So you can see if in your community, you can go to these maps and drill down to zip code levels, and it's broken down at risk based on 0 to 1 years old, 1 to 4 year old, 5 to 9, and on and on. So the risk factors are different for different aged children. So that's one innovation that we've provided, and this also informs how we fund our resources and how we expect our funded organizations to sort of conduct outreach efforts and work with their community. So the other quick innovation, well, the innovation isn't quick, but I'm going to quickly try to talk about it, is our HOPES grants. These are all purely state-funded grants that we provide communities to address risk factors for children or for families with children under the age of 5. 80% of our child abuse and neglect fatalities occur with children under the age of 3. And when we first got this investment, most of the prevention funding was aimed at school-aged children, and we knew we needed to start filling that gap and really addressing those families who might not have the supports of school and who have these very vulnerable children at home. So these were grants that really provide a lot of flexibility to the community to pick an array of evidence-based solutions, and you'll see in them folks doing all kinds of great things like funding postpartum depression screening, or providing equine therapy, or partnering with domestic violence shelters to work with dads, or partnering with their city council to help set budget priorities using data. So there's lots of really cool innovation happening in these grants, and that's really been due to the type of flexibility that the state appropriators allowed with this funding source that we were then able to pass along to the community level. Another innovation is our Helping Through Intervention and Prevention program. This is where this is more targeted. This is a program for our pregnant and parenting foster youth to get home visiting services to help them in their journey as a parent. Because we know we do a lot of work with teen parents, and you both need to address them as a child and their continued youth development, and you need to help them with the new responsibility they have as a parent. And this is one program we have for that purpose. And then a couple other innovations I wanted to highlight is we've had several communities. These programs are all chosen at the community level. We kind of provide a menu of options, and one sort of, it's both a parenting program but also a community mapping and connector model that 5 communities have chosen to implement at a small scale and pilot, is a program called Family Connects. And this is where all parents in a selected in some sort of randomly selected way in a community, and at full scale, every parent with a new infant in a community would be offered a voluntary postpartum visit to their home by a nurse. And they then screen for mom and dad's well-being as well as infant well-being, and just make sure the family knows what resources are available and how to get to them. So it can be as simple as making sure they have a car seat. It can be breastfeeding support. It can be helping make sure they have a ride to their or to their pediatric visit, but it can also be screening for postpartum depression or domestic violence or child abuse and neglect, and they can visit up to 2 more times if there's more intensive needs. But often most families do say, yes, please come, across all socioeconomic levels, and most need some sort of help connecting to a family resource in that very beginning of their child's life. So this is something being piloted in 5 communities across Texas. Also, we spent a lot of time trying to understand how to work with parents at that hospital visit, because it's one of our first opportunities, but it's also a very short period of time to spend with mom and dad, and hospitals are all very different. But this is another innovation that we've piloted with some partners at UT about just a parenting action plan that seems to be testing well with parents to think ahead about what kind of stressors they're going to encounter when they take baby home, and what is their plan to deal with those stresses. So this particular pilot was specifically to reduce abusive head trauma, but we've also been trying to tackle one of our other big risks with infants, which is sleep-related fatalities, and really trying to get squeeze as much effective education in that very beginning time with parents. And then lastly, just to know at that kind of community awareness and norms level, we've done a lot of training of some of these providers curriculum around early infant brain development and trauma that is meant to be disseminated community-wide, and Wichita Falls is a great example where they've trained, I think, up to 2,000 people about just the importance of supporting infants in that first 3 years of their life and trying to raise that kind of community level knowledge about that period of time. So that's just a quick flyby of the work in PEI, and I now have the pleasure of turning it over to my colleague, Deneen.
I just want to say thank you, Sasha and Ann, for the overview that you gave of prevention services here in Texas. I certainly appreciate our partnership together as we work towards better outcomes for children and families in Texas. We're going to look at CPS, and protecting children is the core mission of CPS. If children are vulnerable, meaning safety threats and risk factors are present, and it does not appear that parents' protective factors are in place or adequate, we must plan to mitigate these risk factors to ensure child safety. FBSS works to maintain children safely in their homes or make it possible for children to return home after a temporary safety placement with a relative or someone close to the family or working with the parents, extended family members, and community providers. We do this to ensure parental protective capacities are in place, to build a network of support around a family that will keep children safe in their own homes, to help stabilize the family, and reduce the safety threats of future abuse and neglect. Next slide. So family-based safety services was something that we have heard the commissioner talk about, that she's focusing on prevention. And so when I came to the Texas Department of Family Protective Services, this was one of the first areas of focus that I looked at. Within days, we made a decision to streamline the CPS organizational structure at our state office. We elevated, it's the next slide. Oh, we've gone way past. Can we back up where it shows the structure of FBSS? We do this so that we can have program involvement and initiatives directly underneath CPS. This work in the division is critical to increase safety, preserve families, and prevent entries into the foster care system. So the organizational structure better supports that vision of preventative work that we're talking about today. So current processes, there you go, that was it. So if we look at the current process versus the concurrent stages that we're going towards, this new organizational structure, working with CPI, will explore ways that children and families can begin receiving family preservation services in a more expedited manner. And so we work closely with Child Protective Investigations, and historically, FBSS services were offered after completion of the investigation in the home. So this had to be where the investigators had already determined that there was some unsafe children, or it was a family at risk or high risk, or at risk of another maltreatment event. Before we had to close the case, the investigators had to do all the documentation to that before it could formally get signed off by a supervisor to then be transferred to an FBSS caseworker. And so now what we've done is we've determined changes in this practice. We believe they were necessary, and we're calling these changes concurrent stages, 2 stages, 1 team. Under concurrent stages, the FBSS worker will work alongside the CPI investigator to provide services to families while simultaneously completing the investigation tasks. If you want to go to the next slide. Our goal is to serve families as soon as we identify the need for FBSS support. So we estimate that with concurrent stages, families will begin their services at least 6 weeks, and in some cases even months sooner than what was possible when investigation had to close before FBSS began work with the family. Engaging families earlier in the process allows us to promptly assess and evaluate the family's strengths and needs and provide relevant, expedient support to families at the most critical time of our involvement with them. To achieve this significant shift in practice, work is already underway to update our impact case management system so that both an investigation and an FBSS case can be opened at the same time, which is necessary to begin working with a family before the investigation is closed. This work is scheduled to be completed this September. You can go to the next slide. In addition to the concurrent stages work, CPI and FBSS divisions have taken a hard look at existing policy to determine if we are identifying the right types of families to come over to FBSS. In the past, services have been provided to families who sometimes did not need government involvement in their lives, and at other times, they needed more significant intervention to ensure that child's safety. To that end, CPI and FBSS divisions have created a more robust referral process to ensure a family's needs are getting met. As we have discussed throughout this presentation, as a community service array is bolstered, more families will be able to access needed supports outside of the child welfare system. This allows CPS to focus on hands-on support of families experiencing safety concerns that will warrant the FBSS intervention. And this will help preserve families and will help prevent entries into the foster care system. To support and encourage the practice changes associated with 2 stages, 1 team initiative, we are developing an implementation and quality assurance process. Case readers will evaluate the newly established concurrent stages model through a review process to assess compliance with the new practice. These assessments will focus on identifying improvements needed to ensure the goal of working more quickly with families in crisis and partner with them to keep the children safe. Information gathered from the case review assessments will be shared with our regional leadership so that process improvements can be made on the regional level. Program improvement and process evaluations have been a staple within FBSS. For the past 2 years, quality assurance case readers have reviewed thousands of cases. The information from these case reads has informed our practice improvements and helped support regional and statewide leadership in identifying practice patterns. Through this process, we know where our biggest struggles as well as our strengths are. We are always seeking to improve. We are revamping the current caseload read tool to target specific keystone metrics to secure child safety, such as, did the FBSS caseworker effectively assess and address the safety issue with the children? Did the FBSS caseworker take appropriate action based on that assessment? And were the families effectively engaged along the way? We will also implement business process improvement plans that will clarify roles for regional staff and clearly designate responsibility for implementing regional plans to improve the quality, to provide a more balanced and reliable overview of the quality of our work, while also improving our documentation. I'll pass it back to Ann.
Thank you, Deneen. So we talked a little bit about the kind of the scene setter and where Texas is performing today. And then Sasha and Deneen did a terrific job catching you up on what is happening in terms of Texas's community investment in family well-being, and Deneen in terms of the innovative changes that she is making to the FBSS program, the in-home services to families who have already come to the attention of CPS. So Beth, you want to jump ahead here? I think you have control. Here we go. So here, we've made good progress. You've seen the data. You've heard the innovations that are going on. And again, Texas is in a leadership role. So what's the problem we're trying to fix? What's missing? So I want to share with you, first of all, the premise of the existing child welfare system. We have spent, as a country, billions of dollars, hundreds of millions of dollars in Texas on improvements. Yet we still have the number of children who die from maltreatment is still increasing across the country, even though overall child mortality has dropped. So what's wrong in this disconnect of a huge investment that we've made in the existing child welfare system, yet we've not been able to reduce across the country the number of children who die from abuse and neglect? So I want to show you a little bit here and really focus in on what children are we talking about. And Sasha and Deneen already pointed that out. If we look at children in the first year of life, that's where we're going to see the highest investigation rate. So those are cases that came into intake and are accepted for investigation. That's not surprising. I think what we need to keep in mind, though, is 84% of those cases are neglect. They are not abuse. If you look at all children in Texas, 2/3 of the cases that come to CPS are due to neglect. They're not due to abuse, either physical or sexual. So I think that really, tells us something there in terms of what's happening. Beth, you want to jump ahead? So we know that the children coming in, and we are for infants is a large cohort, but then we look at, for those very young children under the age of 5, what does this data tell us? The data tells us, compared to the general population of children, that by the time children come to the attention of CPS, it's often too late. If you look at that high percentage of children who come into foster care who have significant delays when screened from developmental programs, that really tells me it's too little, too late. How, as a system, did we miss those children? Next screen. So same thing with child maltreatment. Again, if we look at child maltreatment and what is happening, we can see that the ages 0 through 5 are the highest proportion. 50% of that 84% are under the age of 1. So there's clearly a population we need to be able to reach if we're going to address abuse and neglect. And again, the highest proportion is neglect. It is not abuse. So let me jump ahead here. So we've made some really good investments, and now you're probably asking, so what do we need to do next? What is wrong with the current system that, despite our decades of heavy investment, we are not stemming the tide of child deaths? So let me just talk about a couple of things here on what we need to do to really change that and focus on a family well-being system rather than a child protection system. I think the first thing we need to do is redefine safety. Our current system focuses on children who have already experienced some form of maltreatment, most likely neglect, and that neglect leaves them in a state of harm. What we really need to do to define safety is that children are free from harm, that incident doesn't occur in the first place. That brings the family and the attention to the family from the existing child welfare system. Sasha told you a good bit about taking a public health approach. on a population-based prevention efforts. That makes a lot of sense. If you want to reach those itty bitties, if you want to reach those struggling families, you have to look at a population-based system, not an incident-based system, which is where we are today. We know this, we have tools to do that. The data mapping that Sasha showed you is excellent. We know where families need the most help. Where are they living? Where should we be reaching out? Where should those services be provided? I think the third component there on this three-legged stool in terms of transforming is you have to have good tools. You absolutely have the best tools and a fully supported workforce if you're going to make a difference. So let me jump ahead on another slide here. So if we have a paradigm shift from our current child welfare system, and not just in Texas, nationwide, and we go to a family well-being system, what would the before and after look like? We'd be proactive, not reactive. We'd get help to the family before maltreatment occurs. We'd be looking early with a good focus on primary prevention and early intervention. We'd look at strength-based and holistic. What are the assets the family has? How can we help the family shore up those assets so that they know they have the skill to keep children safe? And again, right now we're working on case by case as they come to the attention of DFPS. We're not looking at a population-based effort. We'll jump to the next slide. So we have a new tool coming online. Again, I could see from the early survey, you folks know that. You all are experts. You already know about Family First and the fact that Texas and other states can redeploy some of its 4E investment instead of being focused only on the child in foster care or adoption. You would be able to use these resources to treat the family, to meet the needs of the parents, the caregivers, not just spend those dollars on removal. One more slide. So this, I know you know about Family First. This just kind of gives you a snapshot of, does this mean something? Does this work? And if you look at why children in Texas come into foster care, you'll see substance abuse is a big factor, mental health. Proxy parenting, what we're meaning there is parents don't have the knowledge and the skill to keep children safe. Think about that young mom, a teen mom with an infant, and implications for both the teen and her baby. So we know that the services that FFPSA can help fund make a lot of sense. They're addressing the population that needs the most help. Next slide. So who can do this work? If we're going to change from an incident-based after maltreatment occurred system, and we really want to move to a 21st century system, what do we need to do and who needs to be at the table? First and foremost, it has to be a whole lot more than DFPS. How often when something tragic happens, it's DFPS who honestly takes the public blame. They did something wrong, something failed this family. Yes, something failed this family, but it failed the family long before that family came to the attention of DFPS. Again, as Sasha spoke to taking a population-based, a public health approach with an epidemiological view, this is who has to be at the table. This is far broader than any problem DFPS and more specifically CPS can possibly fix. We have got to get upstream and prevent maltreatment before it ever occurs. One more slide. So where I want to end here is just a couple of points of note. Again, DFPS, they can't do this work alone. A public health approach makes sense. We know from the research that the longer it takes us to reach a family and help with the child, we know that in terms of healthy development and well-being, time is fleeting. We know what is going to happen to those children if the right interventions don't occur. This is not something that can be done solely at the state level. It has to be done at the community level. It has to be a much broader approach. So those are some of the things I want to talk about just in terms of what would a 21st century child welfare system look at? And Texas has much to be proud of, but there's a lot more work to go, particularly when you look at the level of investments and when and where we are making those investments make a big difference in terms of child safety. So I'm going to stop there, and
Thank
I think we're going
you.
to open up now, Sophie, for questions.
Yeah,
Thanks.
thank you, Anne and Deneen and Sasha. That's great information. We've had some great questions come in over the last hour. And so the first I want to address is, are you guys seeing more fatalities, abuse and neglect related fatalities as a result of COVID? Someone just referenced they lost a 3-year-old in Tyler. I know there were some media attention out there at the beginning of COVID about potentially, you know, additional risk placed on kids. And, you know, maybe this, I don't know if this is a Deneen question or what, but I know the department is kind of tracking what those priority levels are as well during COVID, and if the seriousness of cases is getting worse, and if you have any insight there.
Yeah, I'll just share and then I'll let Sasha follow up. What I would say is that clearly COVID puts a lot of risk factors in there that we need to be aware of, that could definitely show some concerns around parental capacity as kids are home 24/7. We have not seen our data yet to see if we're seeing that increase or not. That's something that we're all talking about as we're in this unprecedented time of the pandemic. So we're all waiting to kind of gather that data and see if those trends are there. What would you say, Sasha?
Yeah, I mean, it's so hard to tell because we're not going to be able to really say whether anything was COVID related or not, or whether it was because of all these other things that the pandemic is causing, like lack of access to services or lack of awareness of the kids in schools. And so, you know, we're still, you know, as you well know, because your organization has been so much a part of tracking child fatality data and understanding it, it takes a while before we kind of complete these investigations, determine what happened, determine whether they're really in the purview of the agency or not. And so it's just too soon to give a definitive look at what's happening and what's happening without, I mean, the bigger question I think that we get all the time is the impossible one, like what's happening that we don't know about, because reports aren't down anymore because it's summertime. So right now the kind of reports are actually up compared to summer of last year because of COVID. I think people are calling in with concerns about either children testing positive or children being exposed in other families or households. So they're actually a little bit higher than they are during the summer months, but they were lower in the spring, and we expect them to be again lower in the fall than they typically are when kids go back to school. So that's been, I think, the other big conversation is, what do we not know about, and when will we, you know, how and when will we become aware of the kinds of risk factors and impacts to kids? How will it show up? When will it show up? Where will it show up? And how do we try to get ahead of it in a pandemic world? I think that's kind of been more of the conversation without knowing the hard data yet. And we're the same, like all of our colleagues, nobody has really good real-time data about much of anything. Same with the local child fatality review teams is the same. You know, fatality reviews just take time, unfortunately, which is hard when you're trying to tackle something real time. So I think we're all sort of struggling with that. And working by anecdote is not really scientific, but it's all we've got right now.
Yeah.
Thank you. This is a question that tacks on nicely. Do you know if any training is being given to teachers on how to spot child abuse remotely, particularly in Dallas County? You know, I would add, and Sasha, you can speak to this, TEA did provide some guidance on this really early on that we're happy to share as a resource. I will also let you know that TexProtects has been working with Child Trends to create kind of a curriculum that will live beyond COVID, of course, but how teachers can engage with families during this time and recognizing, but also offering support to the families and what to do if they're not sure. And so a lot of times, you heard Ann say, a lot of intakes that come to the CPS system aren't even about a child abuse issue. They're really looking for help, and CPS is just where oftentimes the community knows to go. And so I know the state agencies, and there's big collaborative efforts to make sure we're pushing people to the right doors, using 211, using Frontline for Childcare, Families Need Help. Yes, there is definitely some research out there around recognizing abuse in a virtual world, and it looks a little bit different, but oftentimes not all that much. And so there's definitely some challenges. And so in addition to the TEA guidance, TexProtects will be getting out some training materials in the next 6 weeks. And so we are happy to share that.
And I'd add, Sophie, do you mind if I add two things I'm hopeful about in the fall that are, I think, lessons learned from the spring that I've heard the school, like TEA, talk about, is more sort of texting, chatting capabilities for kiddos to communicate, because I don't think the virtual classroom space, even though I think they're going to do more synchronous learning, is necessarily going to be a place where kids are going to feel free speaking out, but that they're going to try to provide kids, particularly those older kids, who can make use of that, more ability to text or chat, which is safer, I think, if you're not feeling safe at home. The other thing I'm feeling really hopeful about is they're really talking about, we're a little bit, not that we're not concerned about what teachers are seeing, but more about the kids that don't show up at all. And that TEA is giving guidance to school districts about how to manage those kiddos who aren't showing up for virtual school. And there, of course, will be autonomy at the school district, but I think we'll see some innovations. I've heard of school districts already doing front porch visits. It was before the pandemic, teachers would often do home visits before as a meet the teacher type of activity. And I think we will see school districts do some more of that in-person reaching out when they don't have kiddos engaged. So I think that's another, I think they've learned, and they're, I think, being more proactive about how are they going to address that come fall. And I would assume there's probably going to be a role to play for partner organizations too. So that's just two things I'm hopeful that folks are thinking about ahead of time as they pursue, as we maybe get better in this phase 2 of virtual school, which hopefully won't last too long.
Yeah, that's great. This is for probably Ann or Deneen. A comment about glad to see recurrence of abuse lower in 6 to 12 month measures. Not long ago, there were some 5-year recurrence rates that were almost at 20%. Do we have a current 5-year recurrence rate available? And I believe this isn't something that is available within the CPS, annual data that's reported. And that's something that us as an organization, we're trying to keep updated. But Deneen, I don't know if you have any, or Ann have any comments about longer term recurrent rates.
So Deneen, jump in here, but I am not aware of states that collect that data longitudinally. Clearly, though, if an intake comes in 5 years later, intake and the investigation staff can see that there was a prior case, and that information is very valuable and is used in terms of determining priority and the proper steps to take. Has mom relinquished parental rights to her child and 5 years later has another baby? That's an important piece of information. That doesn't mean the new baby is at risk. It could be mom has honestly grown up. Mom has straightened out what's happening in her life. Mom now has family supporting her. But that is critical information. But I don't know of any state that actually reports fatalities longitudinally over a 5-year period of time. Deneen, do you know otherwise?
No, Deneen doesn't either. But I think that's something we can go back to. And I remember when we were looking at this data, and it wasn't really available in what the state was reporting, but it was pulling some measures together to see what that longer term might look like. So we can go back to that. There's another question, and I'm not sure I 100% understand, but there's a comment about prevention resulting in 94% and not
I
resulting
read
in,
that.
oh, did we
Is
get
this
that?
about whether we have a population control for that?
Yeah. Do we have a comparison of abuse and neglect in other high-risk populations?
Yeah, no, I saw that question. So I think just to paraphrase for everyone else, I think the question is, I said that 94% of the families served by PEI are still not abusing or neglecting their kiddos 3 years out. And how does that compare to similar high-risk groups? Like, so do we have a sort of a proxy control group? And we don't. It's something we are working on. We've long wanted to look at sort of a Medicaid cohort as a proxy, you know, families that might have similar risk factors that we're not serving, to see if what their kind of abuse or neglect rates are compared to the families we serve. And, you know, we haven't, you know, understandably, our partners running Medicaid are very protective of that data. So we haven't yet gotten to do that research project. But we do, I mean, I think the thing that we do know is that the families we're serving are high risk, and that, you know, we've worked with our partners at UT. Most of them have mental health needs. Some of them have, you know, they have a substance abuse treatment needs. They're often dealing with fairly extreme poverty, and most of them have some trauma in their past. That we do know that the group we're working with is a group that does look quite like the families that CPS encounters, but we don't have a great like randomized control to really test if that 94% is in fact better than we would see absent the prevention strategy.
Thank you, Sasha. Well, we are at time. Certainly, if you have any questions for our panelists, you can feel free to send them via email to myself, Sophie at TexProtects.org, and we can see about getting a response to you. I want to thank everybody for your time today, especially our phenomenal leaders, and Deneen and Sasha, and just thanks for taking out the time of your day to do this. And we will be doing a series of these webinars throughout the fall and for the foreseeable future. So be on the lookout for similar topics as well as new topics in the coming weeks. And with that, I think we will let everybody sign off and appreciate your time today.